Hey everyone, thanks for joining us today. My name is Tyler Offerman. I work with the Kentucky Equal Justice Center. Thank you for joining us for a presentation as a part of the Kentucky Refugee and Immigrant Inclusion Summit. We'll be talking a little bit about public benefits, food benefits, and healthcare benefits. And as I said, my name is Tyler Offerman. I work mostly on the food side of things.
Hello, everyone. My name is Miranda Brown, and I work more on the health coverage side of things, so I will be covering that topic. So, can you see the screens now? All right. So, Kentucky Equal Justice Center, to give a little background on who we are and why we're talking to you about these topics. We're a nonprofit, and our mission is to promote equal justice for all residents of the Commonwealth. We work closely with the legal aid organizations, but we do not have some of the restrictions that they have due to their government funding. For instance, we can file class action lawsuits, we can do more lobbying, we can represent undocumented people. We serve through advocacy, so that's legislative policy, administrative advocacy, also through direct legal services and litigation in specialized areas like immigration, health coverage, wage theft, impact litigation, and in Know Your Rights outreach and community education, directly with the community and also through service providers. Our staff are also submitting another presentation to this virtual conference covering housing, and in that presentation you can find up-to-date information on rent and eviction assistance. So take it away, Tyler.
Great, thanks Miranda. Go to the next slide. Great. So I'm going to talk a little bit about some of the nutrition assistance programs, eligibility, nuance, caveats. But first one we're going to get into is SNAP, probably one of the better known programs, formerly called food stamps. Supplemental Nutrition Assistance Program is what that stands for. And it's specifically to help give food benefits for folks that are struggling to make sure that they can put food on the table and feed their families. Go to the next slide. So SNAP eligibility requirements have written out here. U.S. citizens and some legal residents of the U.S. may receive SNAP benefits. Non-citizen parents can apply for SNAP benefits for their citizen children, though. In SNAP, they do benefits by the household instead of necessarily, by the individual. But not everyone in the household has to apply for SNAP. You can obviously go to Connect, we'll probably be saying that a lot, to find more information. But even if you have mixed status folks in the family, that doesn't prevent other folks in the family from receiving benefits. As far as being eligible, again, it's based on household income. So you have to meet 2 income thresholds to qualify for SNAP here in Kentucky. There's the gross income. So that's, all of the money that is made in the household has to be below 200% of the poverty line. And then net income, and that's after they factor in deductions, how much do you spend on rent, utilities, things like that. And that has to be below 100% of the poverty line. The dollar amounts that I have there are per month. So, took those numbers and divided by 12. So, and you can find more information online if you have other family sizes. So you may have heard about an asset test that does exist in other states, but it is not used here in Kentucky, so you don't need to worry about that. What counts as income? Got a couple things there, but it's usually pretty straightforward. If you've got a, strange source of income that you're not sure about, you can always reach out to us or someone at the cabinet for more info. But next slide. Just to give you a sense of how many folks utilize the program, it varies obviously depending on economic conditions, individual income, job losses, but you can see at the height of the last recession, 2009 to 2013, that's when numbers were over 800,000 folks in the state were utilizing the program. You can see as the economy recovered for a lot, but not everyone, those numbers went down, but then the pandemic hit and they've spiked again. So just a sense of there are a lot of folks who depend on SNAP during economic downturns. And that's the whole point of the program, to make sure none of us fall through the cracks. That being said, there are a lot of folks in the state who likely qualify and don't apply. So I'm here to encourage you. If you think you're eligible, please do go to Connect, reach out to us, try and find someone who knows a little bit about the program to make sure you can get the benefits that you deserve. And just a little bit of where SNAP spending is concentrated, just to give you a sense of the geography. There are SNAP beneficiaries in every county. And we want to make sure everyone that needs it gets it. Cool. So when Miranda and I presented to this group last year, we were in the middle of the pandemic. We continue to be in the middle of a pandemic, but some of the measures that were passed earlier on in the pandemic to help folks deal with the economic fallout and the knock-on effects of the health crisis have started to expire, or some of the dates are now becoming a little fluid. So just going to touch base a little bit on some of that. So during the previous part of the pandemic, if you qualified for SNAP, so if you met that gross and the net income limit, then no matter what your income was, you got the full amount of SNAP. It was called the emergency allotment. Some people called it the max allotment or max benefit. So unfortunately, the Kentucky legislature ended our state of emergency during the last General Assembly. And that is important because the federal government said in order to keep these maximum benefits, the federal state of emergency had to be in effect, which Miranda, I'm sure we'll talk more about later. But we also had to have a state of emergency. With the legislature ending our state of emergency, overruled the governor on that, it effectively meant that even though the federal state of emergency is being extended, we cannot get SNAP emergency allotments anymore in Kentucky. And that's really devastating for a lot of folks, and really, I would say, a bad decision by legislative leaders to do that. A lot of money in the local economy, but also a lot of money from individual. So it's unfortunate, but there are still, obviously a lot of great benefits from applying and getting SNAP, even though some of these extra benefits have gone away. During the pandemic, they also increased the base amount. So if you had been on SNAP before the pandemic, even with these going away, the benefits will be higher. Sorry, almost knocked my coffee over. Higher than they were pre-pandemic. So again, yeah, please do look into it. Next slide. Cool. One good way to make sure you get the maximum amount of benefits that you are eligible for is to look into some of these deductions. So when you do apply for SNAP or when you recertify for SNAP, all of these are things that might be available to you. The first 5 are, there aren't any like age limits. It's just if you have it, then you get it. Just make sure to report it. Not every eligibility worker remembers to ask these questions. So be proactive and make sure to say, hey, I've got this, or can I get a deduction for that? The last one on medical expense deductions, that's only for the elderly and disabled. But if you do fall into that category, or if someone in the household falls into that category, then those should be due to you. For the medical expenses, anything over $35 counts. And the list is pretty long. everything from travel for surgery to prescriptions to service animals. So if you have questions about which of those count, please do ask your eligibility worker. And if you need more information, you can always reach out to us. Just a couple things about knowing your rights. You do not need to supply social security number or immigration status for anyone who is not applying. That goes back to what I said before. Even though you have to count all the income in a household, not everyone in that household has to apply for SNAP. DCBS employees cannot share information collected with ICE or other agencies engaged in immigration enforcement. You have the right to interpretation. You have the right to be conversed with in your preferred language and for communications to reflect that. So if you have any problems, we're here to help you, but cool. Great, moving on to WIC, Women, Infant, and Children. It is another nutrition assistance program, but it also includes, sort of extra support and benefits for young children. So you can go to the next slide, Miranda. Seems like I did that thing where I thought the next slide was not this one, but it's okay. I just want to make a quick note about, even though the name is Women, Infant, and Children, you do not have to be a woman to get WIC. I'm sure I'll go over this later, but dads, grandparents, caretakers, I have talked to many folks in those categories who have said like, well, I can't apply for WIC because I'm not a woman or an infant or a child. I realize that's confusing, but dads, grandparents, caretakers can also apply for WIC. So real quick on this one, this was just a recent change. I wanted to make sure to flag it for folks. During the pandemic, this was added to make sure that folks on WIC were getting more fruits and vegetables, whole foods. So this is an additional benefit that WIC participants do get. So make sure to ask for it if that information is not given to you proactively. There it is. The slide I thought was next. So yeah, just wanted to make sure to emphasize that, or the caretaker of an infant child up to 5, so under 5. So great. One other thing to go over is Pandemic EBT. This is a program that was just started, obviously, during the pandemic, but this was meant to supplement meals missed by kids on free and reduced lunch because of school closures, quarantines, or exposures. So there have been a couple different rounds of this program. It remains to be seen if it's a program that'll continue after the pandemic, but it is still currently being administered. So it's another thing to help supplement meals. You can go to the next slide. As far as eligibility, I already mentioned, child has to be enrolled in free and reduced lunch or at a school where all the kids get free and reduced lunch, called a CEP or community eligible school. The way that this round of PBT is working is that the cabinet is getting information from schools about any interruptions to regular school business that were 5 or more days long. So basically the cabinet said, send us a list of all the days where the school was closed, or this building was closed, or the school district was shut down. And then they're proactively sending out those benefits, again, for kids in free and reduced lunch. So this does not include kids in daycare, already mentioned free and reduce, homeschool kids, or children who are in what's called full year virtual academies. I know this might seem a little bit confusing, but the way that the federal government wrote the law, it said in order to get PBT, it has to be an unexpected absence. So like the school had to close because a lot of teachers got COVID or children So if a parent willingly put their child into a fully virtual academy at the beginning of the year, that doesn't meet the qualifications. So if you have any questions about that, we'll give you a phone number later, or again, you can reach out to us. Cool. Timeline here. So the first payments just went out. I'm not sure when you're watching this, but as of this recording on the 27th, of May, good flag.
2022.
There were some hiccups on the May 25th distribution. Some data was incomplete from school districts. I was flooded and continuing to be flooded with lots of questions about that. And pretty much the cabinet is working through those. And yeah, they're doing it as fast as they can. So this is the timeline as it was supposed to be. So acknowledging that there is probably going to be some trickling out of benefits that should have been going out on May 25th. So, over the next couple of weeks, but this is the timeline as it was originally written down. And if you have any questions about the amount you got, you can go to the next slide. Yep, I mentioned reconsideration. So the way the schools send the data to the cabinet, I mentioned 5 consecutive days. There's a good chance that your child, if they did have absences, that would qualify. Maybe it wasn't 5 or more days. Or maybe the school just sent slightly inaccurate data. So there is a reconsideration process where if you think you received less than you should have, starting June 1st, you can call the cabinet and ask for a reconsideration. The number to call is the same one that's there at the bottom to update your address. It's the DCBS call line. And just make sure to have your student's full name, date of birth, and SSID. And then if you want to replace your PBT card, there's an additional number there at the bottom. So yeah, sooner rather than later is obviously good, but acknowledging they might get a lot of calls on June 1st, we've all had to wait on hold a little while. Hopefully you won't have to wait on hold very long though. So next slide. Cool. Just a couple frequently asked questions. I already mentioned, that maybe it's less than 5 consecutive days. So if your child had to quarantine for 3 days because they were exposed, or they got sick and you thought they had COVID and they missed a couple days, maybe it wasn't COVID, but it was a COVID absence. There's a whole bunch of scenarios in which your individual child might not fit into this, very rough set of parameters that they gave for the original data. So just call and do ask for reconsideration. The cabinet will reach out to the school, and as long as when they call, the school says, yes, that child was absent on that day, then, more than likely, I think it gets bucketed into the reconsideration. The amount does vary because the, amount of days a child missed varies so much. And then so the last question, just as far as like new enrollees, it should be automatic. Again, if you have any problems, June 1st, you can start calling for your reconsideration. Next slide. Yes. Well, with that, I will go ahead and hand it over to Miranda, and we'll talk a little bit more about some other public benefits.
Great. Thanks, Tyler. So Tyler mentioned SNAP, and for that, you can apply. One way you can apply is online at kynect.ky.gov. So here's a screenshot of that webpage. The red circle is added to show you that you can click on apply for all programs under benefits. And through that, one can apply for SNAP or food stamps, KTAP, cash assistance, childcare assistance, and Medicaid or K-CHIP, the Kentucky Children's Health Insurance Program for Children. So you can start an application through Connect for any of those programs. But you can also start an application on Connect for other types of health coverage by clicking the box to the left, the blue box. So I'm going to talk more about that. So here's just some basic information to know your rights when it comes to health coverage. Under the Affordable Care Act, no one can be denied health coverage because of a pre-existing medical condition. All health insurance plans, whether it's Medicaid or an employer-sponsored plan or a health plan on Connect, like the page I just showed you, all insurance plans have to cover a set of 10 minimum essential benefits, and those include mental health. Also, since we are still during the pandemic, COVID-19 vaccination should not have a copay, whether you are insured or uninsured. And so if you receive a bill for COVID-19 vaccine, you may consider appealing that charge. Every insurance company has its own appeal process. And then I've included a link here for vaccine appointment checklist and what you need for the appointment. ID would include not only driver's license, but also school IDs, passports, employee badges, expired IDs, and foreign IDs. And that's from Team Kentucky. So the next couple of slides are more generally know your rights information, touching on some of the things that Tyler mentioned as well regarding applying for public benefits like SNAP, but also Medicaid and qualified health plans on Connect. So regardless of immigration status, families that have family members that may have maybe citizen or permanent resident or undocumented or whatever, mixed status families can apply for these programs for the eligible family members. Government agencies cannot ask about the citizenship or immigration status of anyone in the family who except those who are applying for coverage. Now, it may be part of the application, but it can't be required for them to know that information if the individual is not applying for the benefit. States like Kentucky cannot deny benefits to an applicant just because their family member does not have legal immigration status or does not report legal immigration status. And when you apply for Medicaid or CAIDSHIP for children or health plans on Connect, all of your information that you submit is necessary to determine your eligibility, and it's only used for that purpose. The Immigrations and Customs Enforcement, or ICE, assures that they do not use any of that application information for immigration law enforcement. Regarding Social Security numbers, providing those on an application is optional, and it's part of the application. Agencies may ask for your Social Security number because of needing to verify income information, among other details. Even if the household member is not applying, they may ask for that information for those reasons. However, non-applicants for these programs do not have to provide a social, and their family members cannot be denied coverage or benefits for that reason. And for language access, not only does this apply to Medicaid offices and call centers and to Connect, but it also applies to any medical provider, any doctor's office who accepts Medicaid. Because they accept that federal funding through Medicaid, they have to comply with the Civil Rights Act. And if a patient on Medicaid requests help in a different language than English, then an interpreter must be provided at no cost to them. So digging more into Medicaid and the public health emergency, as Tyler mentioned, we are still in a federal public health state of emergency, or PHE. It was renewed in the last 90 days through July 16th of 2022. States are supposed to receive a 60-day notice from the federal government prior to the ending of the state of emergency. And so it's very possible that that will be extended again past July, since we are within that 60-day window already. Medicaid, this is relevant for Medicaid because Medicaid renewals will not start generally until after the end of the public health emergency. However, so that we are prepared for whenever that happens, it is really important that anybody enrolled in Medicaid make sure to update your contact information in Connect or by calling DCBS, the Department for Community-Based Services, or by reaching out to a connector for help updating that information so that when the public health emergency ends and it is important to renew your health coverage, that you received a letter telling you to do so, for instance. And so that your information is accurate in the system so you're not terminated for a reason that's not even true. You want to make sure your information is up to date, including income as well. Medicaid managed care organizations. So Kentucky is managed by 6 different companies in Kentucky called managed care organizations, or MCOs. And they are beginning to send out letters to their members to notify them of the upcoming renewal. It is also important to note that Medicaid is not only free when you enroll, but free when you use services. Senate Bill 55 has permanently, in Kentucky, has permanently prohibited any form of cost sharing, including copays in Medicaid and K-CHIP for children. So I also want to touch on presumptive eligibility, or PE Medicaid. If you live in Kentucky and have no health insurance, this may be an option. Kentucky is currently allowing for 2 PE periods of enrollment within each calendar year, and each period is 2 months. When you apply for PE, it covers the month in which you apply and the following month. So it may not be a full 2 months if you apply partway through the first month, right? Coverage is not automatically extended. If you need coverage for a second period, you have to apply for it again. You may be eligible if you are uninsured or under age 60 and under age 65 and have income at or below 138% of the federal poverty level, which is the Medicaid income limit. There is no premium and there's no documentation required. You don't have to submit proof of your income. You just attest to it in the application. So here's a link included on this slide for accessing that application. Once you go to that link, you click apply for time limited coverage. All PE Medicaid is currently being managed by the MCO United Healthcare, and overall 2,000 to 3,000 Kentuckyans are currently covered by PE. So here is a screenshot of Connect, KYNECT, .ky.gov/benefits, where you can click on apply for time limited coverage and apply for that PE. But if you're eligible, and there's the actual PE application once you click on it. And note here that Social Security number is not required to complete the form. Next, I want to mention that Kentucky Equal Justice Center is a member of the Thrive Kentucky Coalition. We can't do all this work on our own. Tyler has been really active in the Thrive Kentucky Coalition, and here's a list of the steering committee organizational members where KAC is included, among other advocates we are advocating as a coalition for a strong and equitable safety net in Kentucky. And the reason why I mention this is because a lot of the slides that I'll be using in the next few slides that I've put in this specific format were adopted. I've adopted them with permission from Priscilla Easterling of Kentucky Voices for Health in her presentation as part of a monthly Thrive Kentucky public forum online. So thank you, Priscilla, and Kentucky Voices for Health and all of the Thrive Kentucky Coalition. So I mentioned PE, but if you're eligible for something longer term than PE, then definitely apply for that, for whatever's will get you better coverage for longer. So I've listed some programs here: Medicaid and K-CHIP. These are free health coverage. And when can you enroll? Well, any time of the year for Medicaid and K-CHIP, you can apply on connect.ky.gov or by calling DCBS or by getting a connector. And there is an open enrollment period for these programs, but it's a time when you can change from one MCO to another. But you can actually apply and enroll in the program at any time during the year. So there's also the health insurance marketplace, which in Kentucky is called Connect, KYNECT. And open enrollment for the marketplaces generally begins on November 1st for the following coverage year. So obviously we're not during open enrollment right now. That's generally November and December. This year it went to January, but his open enrollment is closed, but you can still get a special enrollment period based on life changes and exceptional circumstances. So I'm going to go over that in the next few slides. But I also want to point out that if you want help, if you don't want to do it by going online, there's several steps to creating an account, or if you don't want to call and wait on hold, you can find a local connector who can help you navigate that process. So who is this information relevant for, right? Who can go and apply for Medicaid or K-CHIP or other health plans on Connect? This is relevant for all Kentucky residents who are citizens or who are lawfully present. If they have an immigration status that will last the duration of the coverage year, which is the calendar year, and they may be eligible to enroll in a health plan on Connect of one type or another. So here's a screenshot, again, showing that same screen on connect.ky.gov, and you can click on health coverage, and you can actually click there to apply for whether it's Medicaid or a qualified health plan. Now, why would someone have a qualified health plan rather than Medicaid? Generally, it's going to be for people who are under age 65, whose income is above the Medicaid income limit, and they don't have a health plan through their employer. It's also relevant for some immigrants who may not be eligible for Medicaid because of immigration status, but could still get a qualified health plan on Connect. And Connect offers tax credits to make private health insurance more affordable if you purchase your health plan through Connect. And so that's the benefit of getting a health plan through Connect, and why it's such a big help. And I want to note here too that I mentioned a qualified health plan is available to you if you're under age 65, but there are some immigration statuses, depending on what your status is and how long you've been in the country, and if you've been working, then you might have an immigration status that means that you can't get Medicare just yet, but you're over 65. And if somebody is in that situation, you can still get a health plan on Connect and utilize the tax credit to help you afford the health plan. So here again is a screenshot of if you clicked on health coverage on the previous screen, it would take you here. And from here, you can click sign in or sign up if you need to create an account to apply. And in the upper, in the menu bar, in the blue menu bar at the top, I've circled there in red, you can also click reps, connectors, and agents to search for a connector in your area who may be able to help you apply. So again, more information on how to apply. There's the link again, the phone number, which I don't think I included on the previous slide. And if you started applying on your own, but you ran into issues, technical issues, or maybe you got a denial and you don't think that's right, you might start by contacting a connector to help you troubleshoot, or by appealing. You may also decide that it would be helpful to appeal, and you can actually get local legal aid to help you with that. And there's a link there, kyjustice.org, to search for Kentucky's civil legal aid providers. So next, on the next couple of screens, I want to talk about what are the options for enrollment in Medicaid and qualified health plans. What are the insurance companies that are offering, and managed care organizations that are offering this coverage? So this screen shows the 6 managed care organizations that are covering Medicaid in Kentucky right now, and special benefits that they offer and links to their websites. For qualified health plans on Connect, Kentucky has recreated the state-based marketplace, and Connect is offering an increased number of medical plan issuers as compared to last year. And so we have 71 individual health plans and new expanded bronze plans. There are silver, bronze, and gold plans. So the bronze ones there are more options. And there are also 8 standalone dental plans. And for the very first time since the beginning of having Connect in 2014, the very first time we have vision plans. So here's just a map showing where the 4 different health plan issuers are throughout Kentucky. So some of them are in Anthem's in every county, but some of the other ones are only in certain counties. You can see on the map. And then for dental coverage, 98 counties have access to standalone dental plans from these 2 issuers, and all 120 counties will have access to at least standalone dental plans from one of the issuers. So here again, if you go to connect.ky.gov/health coverage or the previous slides and click on health coverage, you get to this page, and you can then click on qualified health plans. And right now I just wanted to show you how to, you can scroll down and find more information about vision care. And I'm pointing out how to find information about vision care specifically because it is not part of the application for medical and dental coverage. It's separate. So a lot of people maybe experienced in the past that they tried to get a health plan on Connect or on the federal marketplace, and it wasn't affordable for them. That may not be the case this year because of the American Rescue Plan. This act included financial help to lower the cost of marketplace health insurance, including state-based marketplaces like Connect. And so many Kentuckians are seeing large savings on their monthly premiums through Connect. So new marketplace enrollees have saved an average of 25%, while current enrollees have saved an average of 40% nationwide with increased subsidies, thanks to the American Rescue Plan Act, or ARPA. And these subsidies will end at the end of 2022 without Congress passing Build Back Better or other legislation that extends them. So I mentioned earlier that we have an open enrollment period, which is we're not currently in, but you may qualify for special enrollment if you have qualifying life events. So you would apply just like you would for a regular application on Connect, but they may ask you to submit documentation to verify that you indeed had a qualifying life event. These are just some examples of what might meet that requirement. If you had a change in your family status or size by getting married, having a baby, adopting a child, for instance, or if you moved to Kentucky or moved from one health plan service area of Kentucky to another, and there are different plans available, or if you turned 26 and lost coverage through your parents' plan, if you lost employer-sponsored insurance, if you lost COBRA coverage or other private health insurance, if you got divorced and then lost coverage because of that, if you lost Medicaid or K-CHIP, or if your income changed to the extent that your payment assistance or tax credit or subsidies changed or special discounts changed through Connect, then you could qualify to switch to a different plan. However, enrolling in a Connect plan and not paying your premiums on time so that eventually your plan terminates, that does not qualify you for a special enrollment period generally. There is also a term called exceptional special enrollment. This is when you don't necessarily have a qualifying life event that falls into those 6 broad categories of losing health coverage or changing household size, etc. But you had other circumstances that prevented you from enrolling in coverage during an enrollment period. That might be like you were incapacitated during the open enrollment period, or you were affected by a natural disaster, or you were experiencing domestic abuse or spousal abandonment, or you had a technical or system issue that prevented you from enrolling, then you might qualify for exceptional special enrollment. And there is a process for how to enroll in a exceptional special enrollment. So I've listed the steps here of what one would need to do, and it may be helpful if you need to do this to get a connector to help you. It's not required though. So I also want to mention that there is an exciting new opportunity. The federal government has opened this up, and now Kentucky is as well. It's a new low-income special enrollment period. And so while you may not meet the requirements for a qualifying life event for a regular special enrollment period or one of those exceptional reasons. If somebody is under 150% of the federal poverty level and eligible for an advanced premium tax credit, they may be eligible for a new special enrollment period or SEP on the marketplace, allowing them to enroll in a plan in any month during the year without having to experience that qualifying life event. So as of March 2022, the Center for Budget and Policy Priorities estimates that about 7,000 Kentuckians will qualify for this SEP. It's temporary though, only for the rest of 2022, unless Congress does something to extend it. How do you apply for this type of SEP? It should be available on Connect starting in June 2022, but with the help of a connector, you can go ahead and request it. Connectors can request this for their clients by contacting KHBE. So I've talked a lot about programs available on Connect, but I do want to mention, what these programs or who these programs don't serve. They aren't designed to enroll undocumented immigrants or immigrants with DACA, Deferred Action for Childhood Arrivals. And so I want to talk about this. What programs can these folks utilize to get their health needs met? You may know about community health centers and clinics in your area. I know Lexington and Louisville have a lot of them. More rural areas may have options as well. And there are, if they're a federally qualified health center, they have rules about how much they can charge for their patients. And it may be a sliding scale, and they may have financial assistance available for people who can't even pay on the sliding scale, right? And so these are really important to know what's out there in your community. Retail clinics like pharmacies or department store clinics, insurance through someone's employer or directly through an insurance carrier, presumptive eligibility Medicaid, which we already mentioned, and I'll talk a little bit more about in the next slide. Emergency Medicaid, which I'll also talk more about. Disproportionate share hospital and hospital charity care and financial assistance. This is obviously specific to hospital care. Disease-specific programs and so like for cancer or diabetes specifically, for instance, prescription assistance programs. And at the bottom here, I've included needymeds.org. This is just a really great search engine even for finding these types of programs. So I mentioned presumptive eligibility Medicaid, and I wanted to touch on it again, because not only does it cover uninsured people because of how Kentucky has made it available during the state of emergency, but it also, or during the pandemic at least, but it also is used and has been used even before the pandemic to cover pregnant women who qualify for Medicaid in every other way except for their immigration status. And it's generally the medical providers that help pregnant people apply for this. So emergency time limited Medicaid, this is maybe one of my most important slides because it is so important that immigrants who don't qualify for Medicaid, even if they could get a qualified health plan on Connect, but their income is low enough to actually qualify them for Medicaid, and the only reason they don't is because of immigration status. Whatever the case, if somebody's insured or uninsured, but if they're under the income limit for Medicaid, they should know about this program. It's referred to as emergency time limited Medicaid, and sometimes people shorten the name, but I like to use the whole name to avoid confusion. And it covers hospital bills, doctor bills, and whatever, but only for the care of an emergency. So it will cover COVID-19. It will cover childbirth, but because of federal restrictions, it does not cover organ transplants. It only covers 2 months at a time, but it can be renewed. And I have seen people that because of their long-term condition and the emergency nature of it, I have seen patients get it extended for years, even though they have to reapply every 2 months, or sometimes they're allowed to apply every 6 months. But generally from the beginning, you get it for 2 months at a time, and then you have to request it to be renewed. You can apply for this at the hospital or with ECBS, Department for Community-Based Services, or with the help of a connector. And connectors may not know about this program. They may not know, they may not have helped people enroll in it before. So it's, if you get a connector to help you, just insist, yes, I want to apply. And when you get through, there's a question in the application that asks, do you have an emergency medical condition and what's the start date? That is the key question that triggers screening for this program rather than regular, or in addition to regular Medicaid. And so you can actually initiate the application that way. So another important point is that you must apply within 3 months of your emergency care. So if you had an emergency in January, February, March, and it's already May, you've missed the deadline. You can't go back and apply for emergency Medicaid. So it's really important that you not hesitate and wait, but that you apply as soon as possible after your emergency to make sure that you meet the deadline and get everything in on time. So disproportionate share hospital program. These are federal funds that hospitals receive to cover low-income uninsured people. It helps people who are that you have to meet income limits. And hospitals may screen for this specifically, or they may screen for their own financial assistance or charity care programs, which receive funding from this. Then they may also receive funding from other sources. So next, I want to talk about public charge, and this is really the last topic in our presentation. And public charge is something that is funny to talk about because it really doesn't affect most people. It doesn't affect anyone applying for Medicaid and SNAP for food benefits at all, or health coverage benefits generally. But people are concerned about it and ask about it. And so that's why we wanted to include a couple slides on this topic. But what is public charge? In immigration law, public charge refers to a person who is likely to become dependent on the government for support. The government only assesses public charge when an immigrant is applying to enter the U.S. or applying to become a lawful permanent resident, or LPR, or green card holder. So it is not looked at any other time, not when you become a citizen, for instance. And there are only 2 types of public benefits that the government will look at. They will look at cash assistance for income maintenance. So that might be Social Security, SSI, or TANF, which in Kentucky is referred to as KTAP, the cash assistance for needy families. That's one. And then they may also look at institutionalization for long-term care at government expense. These are the only programs and only times when this applies. And it's important, people may think that it changed or that it applies in other circumstances. And it did very, very briefly under the Trump administration. They tried to change it. It was halted for a while. And now under the Biden administration, as of March 9th, 2021, they have reverted back to the rule that it was before President Trump. So what are the most important things that an immigrant should know about public charge? A, we are in a pandemic, so really important to note, COVID-19 testing, prevention, and treatment does not count against an immigrant for public charge tests. Using these services help everyone, and it's not counted against public charge at all. Number 2, the only benefits which affect public charge are cash benefits like SSI and KTAP, and long-term care and institutionalization at government expense. Nothing else counts. And 3, public charge is not even considered for some immigrant types. So 4, every situation is unique. If an immigrant is concerned about this, if they're not sure if it's relevant to their immigration type or not, always consult with an immigration attorney. So we've included here a link to search for an immigration attorney in your area, and Kentucky Equal Justice Center's immigration attorneys are on there. as are many others. So the last few slides, that's it on public charge. The last few slides just have links to more information, really great information in multiple languages about public charge, about how to enroll in the benefits, the programs that Tyler and I have mentioned in this presentation, and more information on Kentucky Equal Justice Center and how to follow us and get updates from us on these programs and other information. And lastly, we are part of the Thrive Kentucky Coalition. So we will share more information about the other partners in the coalition in the accompaniment to this video. But the Thrive Kentucky Coalition is going on a roadshow and will be in your region of Kentucky sometime in the year to give more updates on these and other programs that benefit all Kentuckians and help keep our safety net working for Kentucky residents. So we know that things are changing rapidly, and we are all trying to share up-to-date information. And this is just one way to keep up and keep in touch. So that concludes our presentation. So thank you all for tuning in and engaging, and please share the information that we've shared, and remember to check back on our sites and our partner sites for more up-to-date information, because it is changing so rapidly.
Great. Thanks, everyone. Thank you, Miranda.
Thank you. Have a good rest of your conference.